This is our third strike and it's getting beyond ridiculous. Nobody's listening to us. Police are getting looked after, teachers are getting looked after, we're being forgotten about.
For the work we do, the pay's not worth it anymore, and I'm just had enough.
The mental stress that you take home every day is just crazy. Like, it's not worth the pay.
We're hemorrhaging staff to other states. We're losing good people.
We're constantly doing overtime, not just for the staff shortages, but to cover the gap in our wages and just to afford to live.
I mainly do night shifts, and you look at what you earn for what the hours and the hard work that you do, and it's just not there.
The staff are completely burnt out, exhausted, sick of working short, 1 to 20, 30, 40 patients in the SIN area in the waiting room. It's unsafe, and the staff, they've had it.
Just can't even put into words how tired we are and how angry we are and how desperate we are. We're crying out for help.
More than 65,000 nurses and midwives have walked off the job as part of a statewide strike for better pay. They have rejected the government's current offer as insulting and only worsening the gender pay gap.
Nurses striking across the state say only a 15% single-year pay rise will truly recognise the work they do.
Pull your finger out, Chris Mims! We're exhausted, and these boys have to start listening. You deserve more.
I didn't become a midwife to stand on the steps of Parliament begging for better pay and conditions.
As a single parent, as a nurse, it's just not fair. We just can't manage with what we get at the moment.
And there's so much inflation, like we just can't survive with the current pay that we're getting.
Nursing is hard enough. Why should I also not get paid fairly?
I already have the second job because as a single mom, I can't afford living in the most expensive city in the world and you get the less pay.
If you don't do the overtime, you don't get enough money to survive.
It's ridiculous. We got a degree for us to get paid like retail workers. Pay us more!
Rather than sit down at the table and come to real solutions, they'd rather just tell the community that you deserve no more than 3%. Shame on them!
Chris Mims, you continue to lie to the public about there not being any additional funding to support a suitable pay rise for the biggest female-dominated workforce in this state.
And if it was male-dominated, it'd be a bit different story.
And Minns himself even said, oh, the cops will come knocking, the teachers will come knocking if we give nurses a pay rise, but he's gone and given all of them a pay rise and not us.
And like, I'm so happy for the cops and the teachers, but like, what about the nurses? What about the midwives? We work just as hard.
It makes us angry that we're fighting for the crumbs from the table. It's not that they don't have money to pay us, it's that they actually have their priorities wrong.
There's no health system without us!
It's very disappointing that us prioritising patient safety means that we can't get our fair wages.
It's not fair to hold ratios over our heads and refuse to give us a pay rise. No other industry is expected to pay for their own resources out of the pockets of their workers.
We shouldn't have to live below the poverty line and struggle to pay our bills just to give patients the care that they deserve and should have had years ago.
The problem is you need nurses for the ratios, so therefore you need a decent pay rise to get the nurses back in.
The key issue for this government is that they would rather protect their wages policy than fix the staffing crisis in New South Wales Health.
You know, we need the ratios, we need the pay rise that we deserve, and you need to give it to us, or else you'll lose all the nurses that worked hard for this state throughout COVID.
We will happily pack up and leave because it's just becoming ridiculous to live in such an expensive state and not be paid appropriately.
We're 45 minutes away from better pay. We're seeing multiple staff going across the border to get the better pay, better conditions, and I think we're all very tempted at this point in time.
In Queensland, nurses are valued.
We should be too!
If we were to move to Queensland tomorrow, I think we'd get a 10k bonus and probably about 12k extra in a single year.
I'm moving to Queensland. Anywhere but New South Wales.
We want parity with nurses and midwives in other states. Right now!
A Labor government should be looking after its workers. This is not a Labor government! We deserve respect, deserve fair pay, and deserve a government that values the work of nurses and midwives. We will not be silenced, and we will not stop fighting until our voices are heard and our demands are met.